Good evening, everyone. I'm Sayukta from All About Skin Well-Being, and I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. Fungal infections are very common on your skin or on your nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash and it can be really itchy and annoying. So let's connect today with our skin expert, Dr. Archana Patil, live from Titwala, Kalyan, Mumbai, to enlighten us on the topic of fungal infection. Dr. Archana Patil established in the year 2011 her Renova Skin Clinic in Titwala, Kalyan, Mumbai, and is a top player in the category of beauty clinics for dark circle mainly in Titwala. Today, Dr. Archana Patil will share with us on fungal infection. A very warm welcome to you, Dr. Archana.
Yeah, hi. Thank you so much.
Today, as we are going to talk about fungal infections, first of all, what is fungal infection, and how it mostly affects the skin or the scalp or the nails, doctor?
See, fungal infection is basically a superficial infection of the skin. It is basically caused by different types of fungi, which may be present either in the soil, some of them are present in the animals, and some of them are present elsewhere in the atmosphere. Various other things like moisture, humidity is the main contributing factor. And we have almost 85 to 90% of the population that often gets infected with fungal infection in today's fast routine lifestyle.
Right. And yes, fungal infections are very common. Now, doctor, how to take care of these fungal infections and how to tackle it?
See, the fungal infections can affect any part of the body. Like it can affect the skin, it can affect the hair, it can even affect the nails. The various parts of the body can be involved, like the groins are the most common areas, the underarms, the sweaty areas. Then in children, it can commonly occur in the hair. So there are various prophylactic measures like trying to keep your body as dry as possible, especially in the summer season when the humidity and the moisture is at the topmost. So using an antifungal powder regularly, secondly, keeping all your clothes, your soap, and everything in a separate session. Avoiding sharing of things with each others. Then wearing loose cotton clothing in summer season. So these are certain various things which can help us prevent, depending on the type of area that is particularly involved.
Right. And as this is supposedly to be the peak of summers where half of the India is experiencing rainfalls and thus inviting a lot of fungal infections because, as you said, a lot of moisture, humidity, sweat is there. Now, what are the treatment options available for fungal infections, doctor?
See, when we begin with treatment of any fungal infection, basically we focus on the counseling of the patient because the personal hygiene maintenance is very important. Secondly, we have various other modalities. Since it is a itchy lesion, we can use some anti-itching medications for a few times. But the most important line of treatment is an antifungal medication. Most commonly that we have come across nowadays is there are a lot of patients who use over-the-counter medications, which is a cocktail, containing everything, including the steroids. So that is the most wrong thing and does not include as a part of the fungal infection. We should focus on antifungals, which can be given orally in the form of tablets, as well as certain creams and lotions can be applied depending on the type of the infection.
Right. And doctor, how to find out that whatever rashes we are, experiencing is due to fungal infection? How to identify?
See, for this, my only thing would be always go to a skin specialist because he's the best one to diagnose it clinically.
Right.
Secondly, but whenever you see a fungal infection gives a typical picture. It usually starts as an itching small lesion, then becomes red, can be round, and keeps on increasing in the size. As it increases in the size, the central area starts clearing out. So this is a typical feature. Okay. So one can recognize it. Otherwise, the best, most important thing would be to go to a board certified dermatologist or a skin specialist.
Right. So the whole purpose of having this session is to make people aware that what is fungal infection, how to tackle with it, and how important it is to go and consult a qualified dermatologist in case you have fungal infections. Now, many times people, as you say, go for over-the-counter medication. Many times people will think that, okay, it will go, off by on its own. So, as you said, that over-the-counter medication could be, dangerous, harmful. But many times, because people just don't want to go to the doctor at the first step, they want to wait or try some, remedies, etc., so that it can go away. Is it okay, or we can wait, or we need immediate consultation on it?
See, as I said, over the counter, most of the preparations contain steroid. Okay, once it is steroid, it has no antifungal action. So we need something basically which has an antifungal action. Secondly, steroids also reduce the immunity and increase the amount of fungal organisms that are causing the infection. Thirdly, those preparations, they just reduce the redness or the itchiness temporarily. So later on, as it is, you're going to get back the fungal infection. So my advice would always be, it would be better to go to a doctor as soon as possible, because the recurrence rate of a fungal infection is very high. And we have almost patients who come to us for 3 months, 5 months, 8 months. So the more, quick you are to take an action with a doctor, the more better relief and a long-term relief you can get from the fungal infection.
Right. Thus, it becomes more important to go and consult a right person, which is a qualified dermatologist, in case you are having fungal infection. Now, do you also recommend antibiotics, or what kind of antibiotics treat fungal infections, doctor?
See, as I've said before, it is a fungal infection. So there is no bacteria involved in it.
Right.
So
Antifungal, as you said.
Yeah, have no role in the fungal infection. So it is only antifungal that are the best for the treatment of fungal infection.
Now, why I ask this question, because again, during the COVID era, it's still there, but we have seen that COVID, again, it's a virus, right? It's not related to bacteria, but people were going for over-the-counter antibiotics. With fungal infections, people commit the same mistakes. So I think the awareness regarding it is equally important, that for fungal infection, you need antifungal, and for that, you need to consult a qualified doctor.
Yes, yeah, true.
Okay. Now, which is the most serious kind of fungal infection, doctor?
See, fungal infection to begin with is not serious as such. But when we have using the wrong medications, when we are not taking care of ourselves, like washing our clothes separately, or using dry clothes, applying powders regularly, especially in the moisture areas, not wearing loose clothes, tight clothings and everything, when we do not take care, then it becomes a serious issue. Then when we start getting recurrently the infections, then the patient starts getting serious issues about the infection. And there is no particular infection as such that can be serious. But there's one thing that we should notice, that when we go to a proper skin specialist or a dermat, he knows actually the medications that he is giving. So as he knows the effects of the medications, he knows the side effects also of the medications. So I think the other important seriousness about a fungal infection is, if a patient does not go to a doctor and tries to take the medications orally for a long time, then he can lie with complications like some liver complications, some kidney complications. So to avoid all these things, again, going to a proper doctor is very much required.
Right. And whenever we talk of fungal infection, dandruff is again a kind of fungal infection, is that?
Yes, yes. Dandruff is very much like a fungal infection. Just it is a different kind of fungus causing the infection, and it basically involves the scalp, where
Mhm.
the oily glands are the maximum present. So, yes, it is a type of a fungal infection commonly seen in patients with oily scalp or who oil their hair very frequently. Yeah, it is a kind of a fungal infection.
Right. Now, why I asked it is again because dandruff is very common in our
Yes.
society. And as you mentioned, people tend to apply a lot of oil in case they see dandruff. They feel that, these are the flaky skins. They'll just go away if we kind of moisturize our scalp well. So, is oiling okay or not?
See, basically, as I said, any type kind of a fungal infection is a fungal infection because it happens in an oily, moisture, humid area. Okay, so again, applying an oil, you are again nourishing the fungus, so you're increasing the amount of fungal infection again. Secondly, oiling just temporarily just settles down the fungus down. It is not an antifungal agent, so it is not
Right.
going to take out the dandruff as such. So I would tell them maximum our patients we tell them to avoid. But since everybody likes oiling, we just tell them to apply it at least 15 minutes or half an hour before the wash and just let it go after washing.
Right. So the bottom line is that oiling can actually worsen your
Yes,
condition, worsen your
right.
dandruff. Right. I'll quickly take few of the questions that our viewers are putting forward. Chandan Singh is here asking, Doctor, is there a way I can prevent getting ringworm on my feet frequently?
Yes. See, if you are an athlete or you are a sporting person, if you are wearing closed shoes or socks very frequently, one important things would be you can use footwears which are open. Secondly, you can use regularly an antifungal powder which you can spray in between your toes as well as on the foot regularly. Um, Regularly change your socks on the daily basis. These can avoid the sweating and the humidity in between the toes, and as well as prevent the fungal infection in the foot.
Right. Now, antifungal powders are easily available over the counter as well. So, can we use them? For example, I'm not having any fungal infection right now, but then I have history of fungal infection, and I know that this is the time I'm going to sweat, or maybe areas where we normally sweat a lot or oil accumulates a lot. So, can I use a fungal antifungal powder without consulting a doctor? Is it okay to do so?
Yes, yes. In fact, we recommend using antifungal powders everybody who has a high tendency of sweating, then all those who travel a lot. Secondly, nowadays people work out a lot in the gyms. For them also, using antifungal powders on the regular basis, you do not need to consult a doctor for that. You can use clotrimazole powders or ketoconazole powders, OTC preparations, so they can help you out. The only thing is use them regularly, at least twice or thrice in a day, and that will keep you away from the fungal infections.
Fair enough. John has a similar question. Can I get ringworm from my pet?
Yeah, there are certain fungal infections. They are called as zoophilic fungal infections, which can spread to the humans from dogs or cats. Okay. So again, the main modality line would be to, of course, treat the fungal infection in your dogs. Again, make sure you're bathing them regularly, so that they do not keep on getting those fungal infections. And it's not like you need to keep them away from ourselves. They are pets after all. But one thing is, yes, you should treat the infections and get it cured completely so that there's no spreading of the infections.
Right. Nandini Sharma is asking, can oral antifungal drugs be taken in during pregnancy?
Actually, there are still studies going on, but there are certain antifungal drugs which can be taken, and certain which cannot be taken. Okay, so again, under proper guidance of a skin specialist, there are certain medications which can be taken, but the dose and everything again depends on the right person is for the doctor to be judged depending upon the week of the pregnancy. Secondly, if it's a normal pregnancy. Thirdly, the extent of the infection. So depending on that, certain medications can be given.
Okay. Kajal is asking, is it safe to take antifungals long term for a long term?
No. See, again, as I said earlier, as a drug has their effects, there are certain periods that it can also cause some side effects. So nowadays, the basic antifungal that everybody knows is anazole, which is itraconazole. But there's certain limitations to the dose too. If you've taken too much, can cause gastritis. And the most important side effect is liver failure. It can result you into certain other complications of liver and also kidney complications. So yeah, again under guidance you'll have to take it, and yeah, they can cause a lot of side effects too.
Right. So that's why it's important to consult a doctor in the very first, phase. Whenever
Yes,
you think
right.
that you have got fungal infection, go and consult a doctor so that the duration or the dosage can be, minimal. Because the most, if you keep on wasting your time, etc., then of course the length of the treatment will go on and on and on. One more question from Sudhir. How long do I need to take antifungal medicines?
See, there are various areas of your body that can be involved. Now, when you take the skin, suppose if you have fungal infection of the groins, then the medications can go on for 2 to 3 weeks. If you have again recurrence, it can go on for another 2 or 3 weeks. If you have fungal infections of the hair, that is the scalp, then the treatment can go on for even 1.5 to 2 months. If you have fungal infections of the nails, the fungal fingernails, the treatment can go on for 6 to 8 months. The toenails, the treatment can go on for 9 to 10 months. So depending on the type of the area involved, the treatment goes on.
Right. Now, as you mentioned, the fungal infection in your fingernails or your toes. And again, I've seen a lot of patients who are using, medicated tapes, etc., and they are not actually going to the doctor for consultation. So they keep on suffer. Probably they don't know that there is cure or there is treatment, which is not that complicated, or for whatever reason. But what's your take on that, doctor?
You're talking about some specific tape?
The medicated tape, the normal medicated, tape for the nail fungal infections.
Yes, yes. See, basically these tapes, what I have come across with my patients are these tape is basically those corn caps or certain caps, they are used for that. So actually, patients, they are very innocent, actually don't know whether it's a corn or whether it is a wart or whether it is a fungal infection. So they always try to get it done minimally. But again, I would advise them, please do not use any such types of tape. First, most important step is to diagnose the condition. And when the diagnosis is made, there's always a specific treatment. So then we can go according to the line of the treatment.
Right. And as a doctor, how do you diagnose that, whether it's fungal infection or not, and how serious it is?
Fungal infection is basically diagnosed clinically. As I told you, it can be a red, round area with a central flurry. Second important point, it is often associated with a lot of itching. Okay. Third important criteria is it often involves the moisture or the humid areas like the groin, the armpits. Then, secondly, a lot of patients have it in their hair. And there are certain conditions that may mimic or they may look like a fungal infection. In that case, there are certain investigations like a fungal test called as a KOX, creeping, or a preparation can be done. But that again depends on the type of the infection, what kind of a patient it is, then we can go ahead with it.
Right. Simran is asking, do diabetics have to take some specific precautions for fungal infections?
Yes, this is a very good question. Yes, they have to be very careful because since in diabetes, the immunity is very low. So they are considered as special cases or with high chances of getting the fungal infections, which can be very vast, involving a very large areas. And second important thing is they can frequently get the infections. So the first important thing in case of diabetes is they need to see a good diabetologist and get their diabetes under control. And then secondly, regular visit a skin specialist, get a fungal infections treated. And third important thing for them is to maintain a good, very good personal hygiene.
Okay. Now, doctor, as you emphasize that, fungal infection has this tendency of occurring back or recurrence is there. Now, why does this fungal infection occur again and again, doctor?
In today's era, if I tell you, basically, see, every patient usually likes to Google up things, they always want to know what this is, and yeah, they diagnose it themselves, and then they start with their own treatment modalities. So that is one important thing. The wrong treatment can land them with a high rate of recurrence. Secondly, these treatments, as I said, these over-the-counter preparations have steroids, which increase the chances of fungal infections by 4 to 5 fold. Again, the recurrence rate increases. Thirdly, conditions like diabetes, thyroid, a low hemoglobin, or if you're taking certain other medications, pregnancy, lactation, can reduce your immunity. So in these special cases also, certain other important things are required that need to be taken care of. So again, I would again focus on the same thing, is seeing a good skin specialist and getting your underlying treatment also done. So all these factors, if done together, including the personal hygiene maintenance, then the recurrence rate can be reduced to a great extent.
Okay. Now, as many of our viewers are complaining about ringworms, I would like to ask you that a lot of, topical creams are available over the counter. We have seen a lot of advertisements of these topical creams. You said that over-the-counter medication can, contain steroids or things that we don't understand, and it will land us in more difficult parts. Now, the question is that those topical creams, are they okay to apply if we buy them and apply on the ringworms, etc.? Is it okay, or it is equally dangerous?
See, topical creams are not associated with much of a danger. Okay, but creams containing certain preparations like ibuprofen we have in the market, then aleliconazole, we have clotrimazole. These are all antifungal topical creams that can be used. But again, I would focus, there are certain antifungal creams which are also in combination with the steroids. So these should be avoided. So if you're using only topical antifungal creams which are plain, then you can go ahead with applying them. This will again reduce the recurrence rate also.
Right. So again, the bottom line is that please go and consult a qualified dermatologist in case you are encountering anything like fungal infection. Now, those who have a history, or for those whose fungal infection occur again and again, what they can do as a prevention, doctor? I mean, for example, for those weathers or seasons like summers or monsoons, anything that they can do to prevent having fungal infection?
Yeah, there are a lot of hygienic measures and prophylactic measures. See, most importantly, one should understand in today's fast daily routine, it is very difficult for anyone to actually maintain the personal hygiene or these prophylactic measures. But certain simple steps like using an antifungal powder regularly, twice or thrice in a day. Secondly, keeping all your clothes separate, using an antifungal soap for bathing. Thirdly, wearing loose cotton clothes, avoiding tight clothing, avoiding thick clothing like jeans. Secondly, another important thing is what do you say? In the athletes and everything, taking a bath at least twice a day. So these are all when you know the summer season is about to start and we are going to get a lot of sweating, even in the rainy seasons. So you can start them earlier, and of course, they can help you avoid getting fungal infections.
Right. Now, what are the most common fungal infections, or what part of our bodies are most, prone to fungal infections? Though we have already discussed it, but for those viewers who have just joined, I would like you to shed some more light over that, doctor.
Um, Most important thing is the closed areas of the bodies. So the most important area is the groins and the buttocks. They are most commonly affected. Second, we have the underarms. They are also very commonly affected. Third, most important common areas that nowadays we come across is the scalp infections. There are a lot of patients who go out to barbers and everything who do not sterilize certain things and just use the blades from one to another to a third one. They can cause the fungal infections. And nowadays, people are becoming very cautious about facial products, about their skins. So, using certain products for which have been open for a longer time, using products which have been used by the others, can also avoid the other common area, that is the face, where the fungal infection commonly occurs.
Right. Is it contagious?
It is not contagious. Matlab, once if you touch somebody's fungal infection, you're not going to get it. But yeah, it does. The fungus can lie in your linen, it can lie in your clothes, it can lie in certain applications like creams, powders, any cosmetics that you're using, in your combs and everything. So that is why if you have a fungal infection, the most important thing is to try to keep these things as separate, as isolated as possible.
Right. And how prone are children to get these fungal infections? Can they get fungal infections?
Yes, especially in the newborns, if the mother does have a fungal infection, a lot of fungal infection. So since the newborn, the immunity is a little low, so they are more prone to it. So most important source is the mother. So yeah, if she has a fungal infection, she should get it treated as fast as possible. Second are school-going children, especially the fungal infection of the head or the scalp. So they have a very high tendency of passing it on from one to other. So these two are the most common infections that can happen in children.
Right. And again, in case of children, if we take timely advice from a dermat, then chances are that it won't, reoccur, or it won't bother the children
Yeah,
again and
sure.
again.
Because the dermat again would recommend isolating the child's clothing, keeping everything of the child separate. Again, keeping their body as dry as possible. Some people have a tendency of applying oiling their uh, kids. So in that case, again, avoiding the oiling of the kids and everything can help them. So the dermat will properly guide them in both the medications as well as counseling them prophylactically also.
Right. Dharmendra Pratap Singh is here, one of the viewer, asking, ma'am, kindly suggest for tinea pedis. Is the right
Okay,
pronunciation?
right. Tinea pedis is basically a fungal infection of the foot. Okay.
Okay.
It is commonly seen again in those who wear closed footwears and sports shoes and everything, and who have long working hours or who travel a lot, as well as the sports persons or the athletes. So, most important thing again would be try to wear open footwears if possible. Use an antifungal powder regularly. Change your socks regularly. If you have shoes, also try to change them as regularly. If you have an active infection, get it treated with an oral antifungal as well as a cream. It will vanish off in a few days, and then with the personal hygiene, you can maintain and avoid the recurrence.
Okay. Purvi Mehra is asking, can black fungus spread from one body part to another?
Black fungus is basically a type of a deep fungal infection. It does not spread or it is not a contagious infection. It is basically a systemic infection. It has a completely different line of treatment. It can be caused, especially in patients who are more prone to diabetes or who has some kind of lowered immunity. The mode of treatment is different, yeah, but it is not contagious. It will not spread from one person to another. It is completely different type of a systemic fungal infection.
Right. And many a times, again, we have this tendency in our society that in case we encounter any rash or anything which is happening on our skin or scalp, we will first try some home remedies. The very first thing that comes to our mind, especially for those which is itchy or annoying, we tend to apply some aloe vera gel or some other things to soothe the area. So is it okay to do, or it could be harmful?
See, as you said, yes, there are a lot of patients who come to us after application of aloe vera gel. There are some patients who also apply coconut oils, some patients who apply some other creams and moisturizers. But again, the same concept. What you are applying is a moisturizer. Aloe vera gel is also a moisturizing agent. Then we have oils, which are also moisturizing agents. So when the infection is already due to moisture and humidity, so it will not help. In fact, it will increase the amount of infection, just give you a temporary soothing effect. So the longer you avoid it, the much better it is.
Right. So it's not a good idea to apply these
Yes,
moisturizing
right.
agents. Okay. One more question from a viewer. Some do-it-yourself DIYs for this current weather. So we have already discussed it, that what we can do, what we can should not do to avoid fungal infection. But again, would you like to repeat it?
Yeah, again, I don't mind repeating it 10 times as well, as long as people follow it. Most important thing is try to wash your clothing in warm water, because fungus is often stays in the clothes, and the high temperature is the only thing that can kill the fungus in a cloth, the linen, the beddings, and everything. Secondly, try to wear as loose clothing as possible. Keep your soap, your comb, and everything separate. Use an antifungal body wash, nowadays are available, or you can use an antifungal soap. Lastly, wear loose clothing, avoid tight jeans, tight inner garments, and etc. Use an antifungal powder on a daily basis, twice or thrice on the body. These are the prophylactic measures. And if you have a lot of infection, again, the same protocol, please consult a dermatologist.
Right. Now, what are the most common mistakes committed by patients with fungal infection? I'm sure one is that they, end up wasting some time and energy over home remedies or over-the-counter medication. What are the other things that you normally notices in your patients?
One more important thing that we come across is one is there are certain preparations which are very famous among the patients, which are called as deroben, or preparations like ring guard and everything. Actually, they cause more irritation, so it is better to avoid those. Secondly, patients, again, as I said before, avoid using steroid preparations, because steroid preparations just reduce the redness and the itching temporarily, but it is not an antifungal. Thirdly, patients have a mentality that once treatment and then it should go off. But again, one thing I should remind them that we cannot control your sweating, or we cannot control the weather outside. We cannot control your work. We cannot control your traveling. We cannot control your lifestyle. So, prophylactic measures to avoid recurrence is very important. A doctor can only treat the infection.
Right. And before we sum up, doctor, any take-home message for our viewers, things to remember, things to do?
Yes, again, the same thing. Please consult a good skin specialist and get the treatment done once and for all. Secondly, having infection in the groins or any these closed areas makes certain patients reluctant to go to a doctor. But don't worry, once you go to a doctor, everything gets fine. So don't be reluctant. Thirdly, please avoid home remedies because they just lengthen the treatment process. Fourthly, prophylactic hygienic measures are very, very, very important to focus on in today's heavy lifestyle and routine.
Right. So, in case of doubt or in case of any trouble, please go and consult an expert, which is a qualified dermatologist, in case of fungal infection. Thank you so very much, Dr. Archana Patil, for your valuable time, and it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times with you.
Thank you so much for the team. I'm very thankful for them for giving me this opportunity to talk. Thank you so much.
Thank you. And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day to all of you. Bye-bye.